positive for COVID-19 and get well soon to you. That's Dr. Lydia Jani Selby. We hope you feel better. Evacuation of stranded Ghanaians abroad, 1,100 land in Ghana from different destinations across the world. And there's also that story about the Komfanoche Teaching Hospital ordering doctors and nurses at ICU to self-quarantine for the next 14 days.
And the Ghanaian Observer says government exposes NDC's lies over NPP manifesto promises. Okay. And new voters registered, no Ghanaian will be left out, EC boss. And government rubbishes claims of massaging COVID-19 death figures. We'll get into this. And 856 stranded Ghanaians evacuated. COVID-19 trust fund bags more donations. And back page, Nketiah can help Arsenal move to the next level. That's according to Mikel Arteta. And Alfred Duncan unhappy by out-of-position Ghana rules.
The Daily Statesman is reporting COVID-19 fight. SHS students assured of safety on return to school. 370.
Who is assuring them of safety?
Okay, that's on page 2, sir.
I just want to know who is assuring.
Okay, so it's the same story. It's the Eastern region addressing journalists yesterday during a disinfection exercise carried by Zoomline Ghana Limbs. Assistant Headmaster in charge of administration at Pope John's SHS added that allocation. Okay, So it's really just being said that Zoomlion has gone to disinfect the schools, and so they are fine. Pretty much. It's not actually saying who is actually saying this, but they're talking about the things that have been put in place.
We'll take some time and look at that story a bit later, because the headline gives cause for concern that people are being assured of safety. On this planet, who can assure another that they won't get COVID-19? Who is capable of doing that? Anyway, let's go on.
Right, so the new crusading...
Okay, sorry. So it's the heads of the SHSs in the Eastern region.
They've come together to assure...
Yes, they came together to assure and have said that all arrangements are in place to receive both the final year and Form 2 students. And then they go on to list the things that have been put in place. They were addressing journalists yesterday during a disinfection exercise.
Why are we doing this to ourselves? First of all, we're not going to test people before they go to school. Teachers, students, nobody's going to get tested. They are just going to school. So we don't know who's going to bring the thing anyway. And now you, before they even arrive, you are assuring people that they'll be safe.
Fine, yeah.
Why are we doing this?
Anyway.
Let me finish the front page of the Daily Statesman. 375 aspirants, 168 constituencies. MPP prepares for June 20 primaries. COVID-19 is not an excuse to reject the new voters register, says Drobo Chief. That's it for the Statesman.
Well, the new crusading guide says trouble looms at Ridge Hospital. Management sued for 5 million over wife, baby's death, and SHS in the Ahafo region benefit from disinfection against COVID-19. And officials massaging COVID-19 death toll. That's Occupy Ghana expressing worry and adapt to new life under COVID-19. C4C CEO to students.
Okay, on the front page of the Gold Street Business, workers fret over fallen real income, rising inflation deepens woes created by job losses, pay cuts, delayed wage payments, huge technical support for Ghana textile industry impending as GIPA pursues buyers for the sector, and Ghana moves to generate 1 gigawatt nuclear power by 2030. That's it. That was my very last paper.
So the Daily Graphic, which is my last, standoff at Tema Port workers, marine unit disagree over container vessels, and 33,367 to serve as registration centers. Exercise takes place in 5 phases. And back page 2, signed Railway Development Pact agreement explores local assembling of wagons, and construction of fish processing factory starts in JKT.
Right, let's do the online review. It's brought to you by Zenith Bank in your best interest and Goyle Good Energy. You know that Goyle cares about you. They're making sure that you can be safe when you come to their service stations. So they say, let's all follow these simple protocols. 1, use alcohol-based hand sanitizers if you're not in a position to wash your hands. 2, cover your mouth with tissue when you cough and dispose of it in a bin immediately. 3, wash your hands with soap under running water, which has also been provided. at their service stations, especially for the times when you handle money. 4. Maintain a minimum distance of 1.5 meters between you and other customers, as well as attendants, and ensure that you wear your face masks at all public places. 5. Use the electronic payment card, the Go card, to minimize cash transactions. 6. Stay at home where necessary, please. And if you exhibit any symptoms, don't just go to the hospital. Call the COVID-19 hotlines first. They are 055-2222-004 or 055-2222-005. Let's observe these simple protocols together and defeat COVID-19. Continue to enjoy quality fuel and services from Goyle. Goyle, Yenara Yenzi. Right, so bank in 3 easy ways thanks to Zenith Bank. First, you download the Zenith mobile app, Z Mobile, from the Play Store or the App Store and bank on the go. 2. Use the Zenith Internet Banking platform to transfer funds, pay merchants, and do so much more anytime, anywhere. 3. Dial star 966 hash on any mobile device to open an instant account and bank the easy way. Experience easy banking with Zenith Bank. Zenith Bank, in your best interest. So here's what's on myjoyonline.com. About 200 staff of Kwadaso SDA Hospital are being tested after medical director died of COVID-19. 9 casual staff of Anglo Gold Ashanti test positive for COVID-19 in the Upper West region. And Ghana Medical Association warns the COVID-19 deaths in Ashanti region could shoot up. We'll be talking a bit more about that later. Also on citynewsroom.com, let's have a look at the headlines today. Government responds to claim that coronavirus death figures are being massaged. Another thing we'll talk about a little bit later. CNN International has this, and it's loading, taking its time. Let's look at what's on BBC Africa instead. And Lagos suspends reopening of places of worship. That's a decision that was made in Nigeria as a result of growing numbers. And here's CNN. Pressure grows on India's Modi after deadly skirmish. Something other than COVID-19 and Black Lives Matter occupying the major story slot on CNN's website. And that's it for the online review. Let's settle for some stories, shall we?
Exactly. Could you to get into the Ghanaian Observer? And our government is rubbishing claims of massaging of figures. And so you know that, in Kumasi, there's been lots of issues with COVID-19.
Yeah.
The fact that when it comes to, the number of figures, for instance, while the Ashanti region had reported 38 on Monday, we knew that according to the Ghana Health Service, or according to the, national reports, we had 14 out of it. And Occupy Ghana is saying, well, it looks like government is, massaging the figures. Government has come out to say, well, we see the figures as you've seen here today, and then we use the figures to plan and monitor whatever is going on. We then target the regions and districts where we are to send resources. We don't generate any figures. We don't manipulate any figures at the presidency or, for that matter, at the presidential task force level. When the figures are put out, we take it, plan with it, monitor, and then supervise whatever is going on in the country. So that's what the presidential advisor, Dr. Nsiansare, has been saying. Except that if you look at the city rep in Kumasi, for instance, it tells you the number of deaths is 38, while nationally we are reporting 14. So there's a gap of 24. But talking about Kumasi, you know that this morning we'll be getting to Kumasi because there are complaints about lack of facilities also.
Yeah.
They've had to turn one of the ICUs into an isolation center because they just do not have the facilities. And they are worried that if care is not taken, there's going to be a spike in number of deaths.
Let me clarify that because Erastus spoke to them. They haven't turned the ICU into an isolation center. They are simply keeping positive cases in the accident and emergency center. So it's still an accident and emergency center. If you have an accident in Kumasi, anywhere near Komfo-Anokye, that is where you will be taken. And you could be lying in a bed next to someone with COVID-19. The staff who are supposed to be, in an isolation center or in a treatment center, they're supposed to be going in and out, wearing their PPE, taking it off and all that. But regular nurses wearing just a face mask and, doctors who are not wearing full PPE are having to go in and out of A&E with patients of COVID-19 in there. In fact, let's learn a little bit more about this, because Erastus Asaridonko spoke to the Ghana Medical Association head for the Ashanti region. Erastus, good morning.
Good morning, Kojo.
Thank you for your time. First of all, summarize for us exactly what are the concerns of the Ghana Medical Association in the Ashanti region.
Well, so his major concerns were, one, lack of PPEs. And he tells me that doctors have been buying their own face shields, their own gloves, their own face masks, and other things. And when even they are given by the hospitals, it's been rationed. Few nose masks are given to men. When it's finished, it's finished. But these are consumables that they need every single day. And he attributes that to the reason why more of his colleagues are getting infected. And he puts the figure at Confanoche at 20 and even counting. And then his other concern was about the spillover of COVID-positive patients into main wards. And so he tells me that at Confanoche Accident and Emergency, for example, when you enter, the only thing that divides COVID patients from normal patients is a cubicle.
What? Erastus, we want to know more about this. It's time for the BBC now, though, so we will come back to this conversation. But there's a lot to think about already.
*442# is the new mobile banking formation